Good morning.
Good morning.
Am I on the right group? There's only 8 people here, or 11.
I think we're letting folks in. We're bringing them over as panelists.
Okay.
So folks, if you can hear us right now, oops, sorry, I'll look at you. If you can hear us right now, we're just in the process of bringing everyone over as a panelist, and we should be getting started very shortly.
I don't know. That's what I'm trying to figure out. I'm gonna mute myself.
Hi, everyone. So welcome to the Systems Work Advisory Committee for March. We have, I think, brought everybody over onto the panel. So we're going to go ahead and get started. For today, we are going to have Jess Gorton take the lead on walking us through the slide deck because it is very heavy on waiver services as requested from last month's meeting. So I'm going to go ahead and let Jess move forward through the slide deck and welcome and enjoy today's presentation. Good to see everyone.
Thanks, Sandy. Good morning, everyone. Welcome. We're going to jump right in and get started. So we want to touch on a couple of areas today. One will be some upcoming training schedules and different information that the Bureau is going to be sharing and reaching out and working directly with various groups regarding. We also want to give you an update on the provider readiness survey that was distributed. A few updates from our work groups, our RIP and our waiver work group, and then spend the majority of the time working through our new waiver service drafts that our waiver work group has been working hard on over a period of months at this point to develop, and we're really excited to bring them to you all. I have you all over on my other screen and I'm looking at the presentation, but so that I can also look at you all too. So if I'm not seeing a hand or not seeing a chat, please feel free to either come off mute or point out that someone might be waiting with a question in some way. All right, so for our readiness training schedule, what we are introducing, and we've started actually, are meetings with our service coordinators and also meetings with our providers through July 1st in order to supporting both of those groups with readiness planning while we transition to our conflict-free case management and direct billing. Again, those are our July 1st initiatives, so that's what we're focusing on first. So in doing so, increasing our opportunities for information sharing, asking of questions, and just talking about operational readiness in general is what we're trying to focus on. And we have done this through our, as I mentioned, our monthly service coordinator readiness training meetings. And at this time too, we are going to be increasing those meetings to every second and fourth Wednesday. Previously, it was every fourth Wednesday. In addition, we've been hosting for the last couple of months a monthly provider readiness meeting, and we are also introducing and adding some additional meetings into that schedule. So every other Tuesday, starting on March 28th, we will be adding an 11 a.m. to 12 p.m. session. And then that is in addition to our current monthly provider meeting that happens every fourth Wednesday from 10 to 11:30. So if you or if anyone that you work with, talk to, or interact with in your daily travels is interested in attending those or would like to be added to the distribution list for either of those, please go ahead and have them reach out to Jess Kennedy. Her email address is down at the bottom here. We can also drop that in the chat if someone's hoping for a link. Oh, and I see a couple of questions. Oh, okay, a couple folks asking to be added and some folks saying hello. So good morning, everyone. All right, any questions on the readiness training schedule? I would just ask that as you are, as I mentioned before, as you're out and about talking to folks, service coordinators, providers, folks who may have questions about what's coming up, want to be able to ask and talk about with their colleagues and also with the Bureau, to please let them know that these meetings are upcoming and are going on so that they have those opportunities to connect with us and ask those questions. And what we're finding is some really high level questions and then some, pretty granular questions too. So it's important that we have a chance to connect with everyone. Oh, and Jess Kennedy has added her email address into the chat box. So that is there if anybody would like to grab it. Okay, so moving into the provider readiness survey information. So I believe in January, we had discussed in our group sending out a provider readiness survey. We did issue that. And in going over the information, 45 providers and provider agencies responded to the survey, which is awesome. We really appreciate folks taking the time to jump into that information and go through some of the questions. There was a lot of data that came back. So what we were able to pull out at this point is that 76% of the responses were from provider agencies, and 20% of those responses, received were from area agencies. 4% of the responses were from independent service coordination agencies. And 90% of the respondents answered yes, that they have submitted an enrollment application. So that's really huge. And we're happy to hear that. As we go through and try to contextualize the data, we took a look at what services each of those providers said they offered. And we've included some of that information here. The majority of the respondents offering either day, residential habilitation, or specialty services. CSS as well. I think this is likely makes sense based on, the frequency of services and, our interaction with service agreements and service planning as well. Any questions on the respondents? Okay, great. So in terms of the information that the survey respondents share, that they would like more information around and a dialogue around our areas, including claim submission, crisis management, service coordinator functions, capacity building, service authorizations, or folks may know those as prior authorizations, service planning, and then of course rates. So with that in mind, moving into this new schedule, these new the provider readiness meetings and adding those opportunities for conversation, we've added some focused areas, some topics to discuss during some of the upcoming meetings. So some of them will work more like open office hours, but the ones represented here will have these focused conversations as well. And that's not to say those are the only topics that we can discuss or should discuss, but certainly adding some specific time, carving that out to make sure we're talking about some of the areas that folks said with the most frequency that they would like more information regarding. So March 22nd will be a conversation around budgets, service authorizations on April 12th, service planning on the 26th, and then cost of care and room and board collection on the 26th. I think that this information aligns as well with what we heard too during the most recent provider meeting. And in that, as I mentioned before, we heard questions that ranged from, gee, what's direct bill, all the way to, okay, in the current process, cost of care is collected this way. In the new process, I think what I'm hearing is that it'll work this way. So it really did show that I think these opportunities and these meetings will be very beneficial for providers to make sure everybody has that same foundation of understanding and information so that they can move forward and set up standard operating procedures and make any updates where necessary. updates on that before we jump into the work group updates?
Hey, Jessica, can I just add really quick for people to have an eye on? There should also, for provider readiness, be an updated FAQ, frequently asked questions, coming out either end of this week or first part of next week. That should be a good document for kind of prepping for some of those training sessions as well. So just wanted to flag it for the advisory committee.
Thanks, Drew. All right. So in terms of our work group, we have the waiver work group up first, but I may save our work group to second because I think it'll flow nicely into the content for today's meeting, which is the service definitions that we've all been working on in that group. For the rate work group, I believe, and I'm not seeing her name here, I believe Ellen is out this month. And Lori, I don't want to put you on the spot, but is it possible that you might be able to give the group a quick update?
Sure. Thank you, Jessica. So hi, everyone. I'm Lori Vashon from the Bureau of Developmental Services. And just a quick update on our rate work group. We did not meet on our scheduled meeting for March. Our next scheduled meeting is for April 14th. However, a lot of work has been happening behind the scenes for the rate work group. Just to cover some broad stroke topics is the last time we met, Myers and Stauffer did quite a bit of research on different positions within the state of New Hampshire that were in a competitive role with our direct support professional roles. And they received stakeholder feedback that there were some other competing industries that they wanted Myers and Stauffer to do some additional research on the pay rates for the staff in those industries. They completed that research and provided it back to the stakeholder group. So that was a piece that was requested and completed. The second thing that's been happening is they were in the process of validating all of the cost reports for services through our waivers in New Hampshire. And we are pleased to announce that those cost reports have since been validated. So Myers and Stauffer right now is working on the analysis of that data to begin to present some initial draft rates. And again, I emphasize draft rates for review, beginning to review at our April 14th meeting. So that, and we will be discussing those rates thoroughly. How were they drafted? What went into it? What data was used? For a very, I'm sure, robust discussion on each service category and how we're going to work together to finalize those future rates. So that's my update. I'm not sure if there are questions on that. Did they gather information from self-directed programs pay as we discussed? So Krista, as we reviewed at, I believe, our last advisory committee as well, each area agency provided data as well on PDMS program and current wages paid out for the FMEs in those programs, whether they be families, employees or contracts. So that data has been collected from our 10 area agencies. So, and that is the data that we plan on using to begin to discuss our rate discussions.
So
Well,
Lori, I just unmuted myself.
yeah,
As I remember, and I think it was in the advisory work group, we did have a discussion that individuals and families are often paying more than might be aware, like families are supplementing pay. And so we had a discussion about Myers and Stauffer's having direct conversations with family members to get a more accurate representation of what the pay is. And so I'm wondering, if that was done or how that was done before that document was produced. And so I don't know if that discussion was here in the advisory work group or if
Yeah.
it's in the rate work group, but I do
So-
remember having a discussion.
Right, so
So that's what I'm talking about, not information from
Yeah.
the area agency, but information from individuals and families. And if they went back and gathered that information and where that information is.
So I believe so you are correct, that was a request that was made, but we're not pursuing that information. I think that's going to be very different from family to family. However, I think it's critical to state that as we review those rates for each service within PDMS, we will have those discussions about what could possibly be built into the different factors of that rate, knowing that that may exist for some families.
Thank you.
You're welcome.
I do think it's unfortunate because, you know, as people are following along with the documents that are being produced, especially legislators and other people who are going to be making decisions, they're going to be relying on the documents that are being produced throughout this process when it comes, you know, to the end of this, and we're asking them to approve budgets and other things like that, and they're relying on the documents and data that's produced throughout this process. Thank you.
Thank you. Will?
Yeah, thank you. And I'm sorry if this is the wrong time to ask this question, but here's my question. Is when I talk with families, some of them have family members that have multiple disabilities. Okay,
Correct.
so people that might need, you know, ASL or blindness or, you know, things like that. And so you have a DSP that's going to have some additional skills if you can find them. But do the rates take that into account, and can we pay those people because of their extra skill sets? Can they get paid more? Or are they still stuck at what the DSP rates would be?
So I think that's a really good question, Will, and that is why we're also looking at rates, but we're also looking at the level of support need of each individual through various assessments and how that aligns with what rate they may be able to receive for providing services to that individual. As we've talked about, whether it's no matter what the method of service delivery is, whether it's PDMS or non-PDMS, there are individuals that have high medical needs, high behavioral support needs, specialized unique needs, and that we'll be looking at that based on, you know, person-centered planning for that individual and the use of the SIS and other assessments in identifying what level of rate they may be eligible for based on their support needs. So it's a two-part process, I think. Well,
I just want to follow up on that. So
yeah,
the thing is, the way our service delivery system is done, it's all separate, right? We have the DD service delivery system, and something like blindness is not DD. So how do we make sure that, you know, that is covered? Does that make sense?
Yes, it totally does. Some of the questions, and Will, I'm going to be the first to tell you, I'm not an expert in this, but our supports intensity scale assessment that we use will ask a lot of questions about what day-to-day supports does that individual need. And some of those areas, like if I'm not able to hear or I'm not able to see, it's going to come through in that assessment of those additional support needs that I require above and beyond my diagnosis of intellectual disability, if you will.
Okay.
So that will be, all those factors will be taken into account.
All right. Thank you.
You're welcome. Jess, do you just want me to keep going through questions?
Yeah, that's fine.
Okay.
Although there was one question, just to, as an aside, from asking if anyone was taking notes on today's meeting and if the information will be posted on the website, and yes, on both accounts, the notes and information from today's presentation will be posted on our website.
Jess, Kathy has her hand up as well.
Hello. How
are you planning to reconcile for those families, although I'm sure statistically small in number, are in fact doing their entire PDMS program? They are the employer of record, they do all the tax reporting, they do all the payroll. How is the Bureau going to handle telling basically a private company employing staff what they may pay their staff?
So that's a good question. The whole goal of us developing rates, Kathy, is not dictating to any service provider, if you will, what the actual pay rate has to be for their exact staff. If a rate is determined to be paid out, whether, and again, we will have, you know, what's the unit of service for that rate. So in this case, I'll use an hour. It would be an hourly rate. How the provider, whether that be a family overseeing their family managed employee or a, you know, a provider that's in the business of providing a certain service like CPS, identifies the wages of their employee, we will leave that flexibility up to them. Some may offer a higher benefit package, more vacation time, lower wages, or higher wages and not, you know, as robust of a benefit package. How they utilize the rate to provide that service will be, in this case, up to the family and or the service provider.
So it at least leaves the door of possibility open to the fact that families or even other providers will still be supplementing. If the Bureau says the rate for this is X, but you know, maybe we're already paying our staff more than that, then we will continue to have to make up the difference because we can't put in for a rate that's higher than what you say it is, correct?
So I would say I would like you to look at each of the rates as we build them up. Our goal in developing rates in New Hampshire is that it meets the needs of our service providers and the individuals we're supporting. Our goal is not to create a rate that people have to supplement. Otherwise, you know, we won't have service providers. So as we are meeting with Myers and Stauffer on each rate, we will be looking at what does this mean to New Hampshire? What is the buildup of this rate? What, you know, what does that mean? So my answer to you is that is absolutely not the goal. Now, as you know, running any type of support or service, there has to be defined rates within, you know, different service levels. So that is what we're going to work together on doing, Kathy, to
Okay, so
make sure.
I would just echo what Krista said. Since many PDMS families are de facto providers,
Yep.
Omitting us from Myers and Stauffer's direct contact is unwise.
So I hear what you're saying, and I think it's very good for us to be aware of that. I think that you might, it would be when we're working on rates, including PDMS rates, we're highly going to encourage participation in that, to ask us questions on how this rate was established. What does that mean? Is there an inflation factor built into the wage set? Will we determine in New Hampshire a baseline wage for all services for our direct support professionals? Those are all things that we're going to work on and decide together.
Okay, thanks.
You're welcome. Thank you, Kathy and Krista.
Thanks, Lori.
Lori Tyler has a comment out here. Oops.
Oh, sorry, Tyler. Let me see. Let me check it out.
Says, so the wages will be dependent on the service providers.
Yes, so our goal is not to overly dictate requirements for each service provider. As you heard Kathy say, you know, as a family, I want to have choice and control over how service dollars are used on behalf of my loved one. We obviously, if I'm a provider and I offer very low wages, the chances of me keeping my employees are, you know, I'm going to have to compete with other vendors or providers, but our goal is not to actually dictate the actual wage. We will develop rates. We will be clear in the rate development, how they were. The rate was established, but we will not, at this point, we're not planning on following that path.
He also has another comment. It says, I agree with Spinney. In order to discuss the specific rates, we need to have clear communication between the payee and the providers getting the money in order to provide for clients.
Yeah, thank you. We agree.
Thanks, Lori. Any other questions on the rate work group report out? Okay. For waiver work group now, I think we're missing one of our colleagues. Krista, do you feel comfortable speaking to the waiver work group, or would you like me to give a quick summary before we jump into the services? I'll go ahead and start. And if you want to jump in, Krista, please feel free to come off mute or just chime right in. So at our last waiver work group meeting in February, we were able to finish summarizing and reviewing the services that we've developed drafts for, kind of identify as a group that these are the services that we're supporting to move forward as a recommendation, and then bring them forward to you all and start sharing them with our other work groups. So it's exciting. Our next step as a waiver work group will be now to take the provider qualification information and include that in the waiver service definition. So first step is really developing those service definitions. Next step is taking the information and developing language around provider qualifications for each of those services. I think some of them will come more naturally. A certain credentialing is required based on state law and other areas and other authorities, I should say. Other things will be a bit more of a discussion. And then, of course, where some of the conversations have happened and been developed over the end of last year around recommendations and credentialing and training, we now have the opportunity to incorporate some of that into our waiver service definitions in those provider qualifications, so that our colleagues in the other groups can take that information and use that to compare against some of the work that they're doing. So our work group is not meeting in March because we're developing some provider language, or excuse me, some provider qualification language to bring back to the work group in April so that we can all jump in and start editing. It looks like we have a couple questions. Oh, okay, a little bit of follow-up on rates.
Yeah, so it looks like so there's 2 points that I see here, as Krista's saying. Lori is making a recommendation that we consider a different time for the rate setting meeting to allow broader participation by family. So I think that's good feedback, and we'll take that back. And the second one for Tyler, I think you're just confirming, you know, that once a rate is established for services, it will be up to the service provider how they utilize that rate to provide the service, including paying their employees.
Okay, thank you. All right, so in terms of the next steps for the waiver work group, I think that the provider qualification information, what I want to share with this group before we start and start talking about the waiver services is some information on the timeline now for the waiver work group and also for the waiver amendments. So the work that we're doing right now in developing and drafting out all of these waiver services, Those will be added to the waiver likely later this year through an amendment. What I want to flag for you all is that you will likely see a waiver amendment coming up soon. So there's one in process right now to add provision of denture services to individuals. That's in the home stretch. That should be, fingers crossed, approved in the next few days. There will be another amendment coming that has language in it around our 7-1 initiative. So that's conflict-free service provision and direct bill. That's what will be included in the first amendment. The work that we're doing now, though, with our groups, that will be included in a later amendment. So just flagging that in case folks see an amendment, get concerned or confused, or wasn't aware that one was coming through. It is really just around those compliance initiatives. Okay, I don't see any hands or chat, so let's jump into the waiver services. So we wanted to make sure that we had plenty of time to discuss this, talk about them. Some of these services will look very similar to what we have. Some of them will look very new and different. And I think it's important that we have the time available to talk with the advisory committee about those different services. With that said, we may not get to our breakout sessions today. If that happens, we'll pick back up next month, but I really wanted to make sure we had enough time to jump in and just talk about the services. Okay, so currently on our developmental disabilities waiver, we have 15 services. Our waiver work group has been working to build out about 35 services. So this would be an addition of 20 services into the waiver. And I'm going to go through them. We tried to figure out the best way to present them in a slide without, giving everybody all of the text and all of that material. So this is how we're trying to introduce them, and we can talk and just dive into what this all means. So the first service would be community residence staffed services. This would be typical so these first few services are all currently being provided under the blanket of residential services. Community resident staff services would be similar to what we know now as maybe 24/7 staffed residence by a provider operated home. So it would continue to support that service model. In addition, though, what we are seeking to add into this waiver amendment, in a draft service definition, is community residence apartments. So this would be delivered still in a provider operated residential environment, but where individuals reside in their own living apartments, living units that are separate and distinct from one another. And the services are provided by agency staff that don't live in that individual's unit or apartment, live nearby. What's exciting about this is that we've had a few different folks reach out, different provider agencies, both in New Hampshire and outside of New Hampshire, who are really exploring the development of similar service models or a similar service model and bringing that into New Hampshire. So it's exciting to see our work group kind of thinking of and dreaming of this vision and including a service definition, and there being some interest from a provider standpoint that would both bring housing but also additional service provision into the stage. Oh, Tyler has his hand up. Hey, Tyler.
Good morning, everyone. I apologize for not really showing my face in these meetings, but I'm in an environment where I can do that. So something I just noticed is I actually had an idea where a provider would come into the home of an individual who has an apartment, kind of like what I have Laconia Housing. And something that I noticed is that this is the exact system that I was thinking of doing. So what would be the goal to get clients apartments and things like that in order to help with funding and how they want to be independent?
So within the service definitions, I think what I'm hearing you say are two things. One, are we going to make it easier, through our services to provide services to folks who are living in their own apartments? And there's another component of that question I'm hearing too, which is, hey, what are we doing as a system about ensuring there is adequate housing for folks who are trying to live independently?
Yeah.
So for the first question, I can take that. We are, and we'll go through, but supported living right now is a service that we're adding in, which would be for someone in their own home or apartment that they might be renting or leasing. And expanding on those service setting locations. I think what our work group really tried hard to do is from everybody's perspective, and there are providers, families, folks that interact with the system differently, is to think really hard about the various program models that were out there under the umbrella of residential services to make sure we were accounting for those, not unintentionally leaving out a program model, and then developing them out a bit more robustly so that it could include some additional options.
So it's not like providing individuals with housing. It's just helping them in their own apartment. They would have to find their own apartment and be able to.
Yeah, it wouldn't provide the apartment as well. However, in the context of community residents, in this service definition we're looking at, this would be a provider operated apartment building, or a set of apartments, I should say, where that apartment would likely be part of this would be where the individual lives and receives their services. It wouldn't cover room and board. The waiver won't cover room and board in any circumstance, but within the provision of the service would be that living area, similar if somebody moved into a staffed residence or a community resident staff services, their home would be that would be their home where they live, and their services would be provided there.
Okay, so the way to do that, in order to provide these individuals with services, how would you be able to build like the apartments and things like that in order to get them services, or would they have to go into something like Sunrise Towers or Kona Housing in order to get these services? Or would it just two different branches of things?
Yeah, I think it could be both. And what we're hearing from folks is that there are a couple of different models and visions. So one provider we're aware of is currently trying to build this in New Hampshire. Where they're looking at building an apartment building and providing integrated housing. This wouldn't just be an apartment building for individuals or a series of apartment buildings for individuals. It would be integrated, but some of those apartments would support folks and make sure that there was staffing available nearby to support an individual. And I believe there's another developer out of state, and we don't know, I don't want to put our eggs in that basket too soon, where they're still looking at coming, but it would be, my understanding is that the out-of-state model they have is something along the lines of 20-30 apartment buildings in one area. Some apartments support folks, all of it is integrated, and it's kind of a cool model to think about, and to think about bringing to New Hampshire for both purposes, because I think it would increase some housing options. But also ensure that services were provided in the least restrictive and also integrated and community-based setting.
Another question I have, and this will be the final one, then you can continue. I apologize for other questions.
No worries.
But how would, if an individual already has a house or apartment that they live in, how would they be able to transfer their things into that apartment? Would they get help with getting their things into the apartment, or would they have to get help from other individuals, or how would that work? Because from my own experience, I went through a really hard time just getting out of Easter Seals, and I think I've already talked about this before in a meeting, but I recently got out of Easter Seals, and I did a lot of things to push myself into getting into the human services field, even though I don't have like a degree or anything yet. I still am going to college. I'm getting my degree. But I had a really hard time with getting like furniture and things like that into my apartment, because it's in a place that is not the best, but at the same time, it's like, well, it's better than feeling controlled. A lot of people who are aware of these services have a hard time with control. And I think it's really difficult for clients who are aware and a lot more intelligent and competent to find a way out of the system. So I guess my question is, how would you help these individuals transfer from going into something like Easter Seals into an apartment that is fully functioned within within the apartment services that you're planning to provide?
Thanks, Tyler. So I think you're going to be probably excited. Maybe excited is an exaggeration, but I recall you sharing that with us in a previous meeting, and our work group did identify a service that would assist an individual with some funding if they were moving in that scenario from a provider operated setting into their own home. And it would offer some funding to, you know, get some furnishing, help with some of the moving costs in the startup. So we'll jump into that. It's called Transitional Assistance Services. And I think it's either on the next slide or the slide after that.
Okay. I guess another question that popped up in my head is, if an individual is moving into their own house, would they be able to help them with trying to get mortgages and things like that? Because a problem that I've seen is a lot of companies, specifically in this sort of human services range, tend to only focus on getting individuals jobs and not careers. And the model should be that you should be helping them get their own career and be successful versus just keeping them at a job. So would we be able to help individuals with housing and things like that and being able to get their own house if they can afford it? Or would that just be their own thing since Social Security wouldn't cover it?
Yeah, so I think in terms of getting help, are you envisioning like applying for these things, someone to help walk them through that, or the waiver actually helping with the payment of the mortgage?
So what I was thinking is that it would help if they have enough money and enough things in their budget to help them get a mortgage, let's say in the next 5 to 10 years, then it would help. The service provider would get the information, they would research it, and then they would apply that information to the client and help them to the best of their ability to get their own home. And I guess the way that this would be done is by going to realtors and saying, hey, you know, I have an individual who has disabilities, he would like to apply. And then the client and the service provider would go to the home, and then they would try to, if it fits their budget, then it would help the individual with getting that home. So it would probably pay for those services, but it would also help the individual with their own money to buy that home. And then the services would not only help with housing costs, but it would also help with the individual getting their own home. And then the person that helped the client get into their own home, they would check in every, like, let's say once a week or twice a week. And then if that person doesn't need help anymore, then they can leave.
Yeah, so I think I'm hearing a couple different things that you're mentioning within this context, and some of it could probably be done under the waiver, not under our residential services, but likely, as you pointed out, under service coordination. Some of it we wouldn't be able to do under the waivers because our waivers, but also Medicaid in general, won't cover the cost of room and board. So that would include a mortgage payment, things like that. But what it sounds like is that there might be some other resources out there, you know, that might be able to assist in some of these things. And also, as you mentioned, that working with the service coordinator to identify some of those community resources would be really key. So for example, you mentioned Social Security, and I know once upon a time, and I don't know if they still have them, they had IDA accounts at Social Security. So specific for folks who were trying to save for their own home. And it was, you know, had special exemptions. We have ABLE accounts in New Hampshire so that somebody can save a certain amount of money and there's less implication for them in terms of whether it hurts their Medicaid eligibility or their Social Security eligibility. All of those resources, I think, are important in this conversation. And as somebody is working towards that overarching goal, and that I think speaks to something that we're working on in the Quality Council too, which is, hey, how do someone's overarching goals impact the selection of services that they might include from the waiver, but also how they're able and what they need to access outside of paid services and just in our service delivery system. So I think what you've explained, Tyler, is a really beautiful example, I think, of what the goal of the system is, and broadening these services, making more services available where we can use the waiver to pay for services. But what about and what are the resources to help somebody to achieve those overarching goals beyond just what the waiver can cover? So I think that's a combination of multiple services where the waiver can pay, and then accessing those community resources in areas where the waiver can't pay.
Okay, thank you, Jessica.
You're welcome.
But Jessica, Krista has a comment here, and she says New Hampshire Housing has some programs to help with working to purchase.
Yeah, thank you, Krista. There's some great programs out there to help folks and make sure that I think what we always want to do, and this is separate and aside from our waiver conversation, but more idealistically, what we always want to make sure is that if somebody is saving, you know, and we're talking real, you know, dollars here, if they're saving for something such as buying a home or, you know, being able to afford a home, that it doesn't negatively impact their any benefits or, you know, other community resources that might have an income calculation attached to them. We wouldn't want them working towards that, really, that their goal, what their aspiration is, to impact the services that they're currently accessing. So lots of great programs through New Hampshire Housing, Social Security has some, and I think that the key here is figuring out what's out there, making sure to help people both identify them and work through that process too, to access those other funding sources and other ways that might help. Tyler, do you have another question, or is I just looked over and saw your hand, so I'm not sure if it's still up or if it's a new question.
Nope. Sorry about that.
Oh, no worries. Okay, so for the residential services, what we've also looked at adding in is a specific service category for intensive treatment services. To make sure that the support services that are matched or that are typically included within what we call ITS, an intensive treatment services program, are accounted for within that. And, you know, I think the goal here is to make sure we keep as much flexibility as possible with all of our services, but to make sure that we have those services called out so that we can ensure we're attaching and developing rates with these specific supports in mind. And what those points of difference might be. So our group tried really hard to keep an eye on that, and how do we preserve flexibility, but make sure that we have some options here so that what we were previously working with for, you know, the reimbursements here weren't limiting somehow the services that were being provided. With that in mind, one thing we looked at, oh, sorry, I'm skipping ahead. Next up is shared living. I think most folks currently know that as enhanced family care or shared family living in New Hampshire. Same exact model. The group felt that shared living, which was a much more appropriate title for it. But the service provision and the supports available would essentially mirror what's currently provided and available in an EFC setting. But then jumping into supported living, one thing that our group tried to solve for was, hey, right now, if I were in my own home, you know, there's CSS, there could be some residential. What we wanted to make sure, though, is that in my own home, there was a service that could come and provide services that weren't just carved out for supporting independent living goals, which is still important, but that it can also, there's also a service available to provide within my own home services that might typically be provided under the residential service category. So this would be in someone's own home. When we look at the waiver language, though, that we're queuing up, we wanted to make sure that we weren't unintentionally omitting anyone who maybe their trust owns their home, or in some instances, a family member might lease it on behalf of an individual. So maybe the family member is the actual leasee, but that is the individual's own home. It's recognized as their home. So we have some language that we built in to say that, hey, this is the primary function here is when it's leased directly by the individual, but giving us the allowance to look at the circumstance to see if that's essentially how it's functioning, and the oversight to say that it would meet that category, that service category. I'm gonna flip pages. I don't see a question, but I can always go back as folks are thinking about it. Next is in-home personal care. So another problem that our group was trying to solve for is right now in New Hampshire, to receive services in a family home, really having a 525 certification, a PDMS certification, was the only way to go about that. And I think that it's important that we ensure we have that flexibility in New Hampshire to offer it. But what we've also been hearing from folks is that sometimes they don't necessarily want to self-direct or manage that, but they still want to receive those services in their family's home. So what we're proposing is in-home personal care, essentially the same services that would be available, but this is provided in the family's home without that the requirement that someone self-direct. Again, though, still the option to self-direct that service. Community support services, we're not proposing any changes to CSS. We do still think it's important to leave that in our waiver, offer the service. No changes proposed there. Live-in caregiver support. So this was something that we heard very much so from, individuals, families, providers. This existed once upon a time. There were some challenges in how it was set up in order to comply with some conflicting authorities, I'll say, in different departments and agencies. So what we were tasked with at the waiver work group was figuring out, does this exist in other states? How does it work? What are some best practices to just make sure that everything is developed in a way that keeps, all of the programs free from any conflict with other regulatory entities or agencies or departments. And what we learned is that CMS actually does have some very specific guidance for live-in caregiver supports, which is the services that are provided. You think of it similar to, you might have a roommate who is a paid, and previously my understanding was that roommate might be paid to provide services. They also lived in the home, and on figuring out how to articulate that and show some of the things that need to be sorted through became complicated, and in consideration of all the different authorities. So in us looking at it and what CMS's guidance was, they offer the allowance to pay for the additional costs. So for that roommate, that care provider, of their rent, utilities, and food, basically those living expenses. So this is one of the very few instances where CMS authorizes the payment of what could be considered room and board, but really it is just offsetting that. Now, when the roommate lives there, there is kind of that, as part of living there, that agreement that if the individual who also lives there with them might need some help, what might be natural support from somebody that lives with them if it was in their family home, they would provide that help, but not more than 40 hours a week. This is kind of like, hey, maybe the roommate comes home from work and I'm residing there and I might need some assistance with some meal prep. They would help out. And the reimbursement for that, though, would be the waiver covering the roommate's portion of the rent, utilities, maybe the increase to the food bill as a result of two folks living there. But it wouldn't be a direct payment for that service. And that roommate may have their own, 40-hour-a-week job. They might be college student, a couple of college students living together. It would really just cover those additional living fees. Interesting concept to work through, I think, because our providers and families who may have been aware of previous attempts at working through this really wanted to keep an eye at making sure that all of those things that needed to be worked through that were identified previously were considered, to make sure that this is, something that CMS would support, make sure it's something that our state supports. And I think we were pretty excited collectively to see that this option exists, because it sounds like there was quite a bit of interest in it at one point, and interest in knowing whether or not we could find a way through some of those barriers. And we have a question. Oh, okay. Tyler's just letting everyone know he's switching to his phone again. So he's joining from phone. Okay, and we started touching upon this one before. This is an exciting one, another exciting one. Transitional assistance services. So if someone is moving residential services or switching to a less restrictive environment, so this might be from a institutional setting to any less restrictive environment, or maybe they're moving from a community residence or 24/7 staffed or enhanced family care into their own apartment. As Tyler pointed out, these funds could be used to pay to help with the moving. So it could be moving expenses, startup for different utilities, some, furniture to get into the apartment, to make sure that the individual not only has that home that they've moved into, that spot, but also the furnishings and the day-to-day essentials that they might need in order to be best supported in living in that less restrictive environment. I don't see any questions or comments. You guys are super quiet today. Okay. So then let's move into stabilization services. So the next two services really were built upon what we would typically call right now as crisis services. These are focused very much on residential supports though. And what we looked at was a way to identify the need for additional services. So this is typically staffing in the home and also out of the home. So the problem in a lot of how we built out these services was trying to address something that someone in the group or someone in any of these various groups that we sit on and join has said is an area that either isn't working the best or is an opportunity for improvement in New Hampshire. And our group went out and figured out, okay, what's out there? What is CMS approved? What can we bring to New Hampshire? This is one where what we have heard is that, and you guys probably know all too well, there are instances where in somebody's, say, enhanced family care home, the provider could potentially say, hey, for these reasons, if we aren't able to very quickly have some additional supports brought in, this just won't work, and we might have to give notice. And the hope is that this service will allow for a mechanism to provide those services immediately, the funding for those services, I should say, immediately, while the team is trying to figure out, okay, is this a change in level of need? Is there something going on right now? And maybe these services make sense for a few months, but maybe they're not a long-term need. And then if they are a long-term need, what all do we have to get in order, to represent that and get that ongoing service increased? For example, maybe somebody needs an increase in their enhanced family care, their shared living funding level and their reimbursement rate, something along those lines. It would allow them the ability to act first and then make sure all of those things were in place to represent that ongoing need. Similar to our current crisis service, it would be approved in 120-day intervals. But we did include some language allowing the flexibility for us to offer an additional approval or additional approvals, I should say, when that's needed, especially to best support the individual and keeping in mind health, welfare, safety, but an eye on reducing transitions that are might be driven due to a need in staffing, either temporarily or ongoing. So too is stabilization out of home. Similar, except that the payment for that service, it could be the same scenario where the provider might be saying, gee, in addition to looking at additional services, I think that this would be best figured out with the individual were, able to stay in a respite type setting, not giving notice, but maybe a chance for us as a team to look at the individual support needs, see what we can line up within the home to best support them and ensure that the provider also felt supported in their ability to carry out and meet those support needs. So this would offer those services to be provided in outside of that home where they are in either a respite setting, could be a provider operated home, a shared living provider if they had the capacity at that point in time. We want it to be flexible in the types of places, make sure we're keeping an eye on health and safety and where it can be provided, but also offer some flexibility as well and where that might be able to be provided. Similarly, it offers 120-day approvals at a time, but same flexibility being recommended from our work group to extend that as needed based on, health and safety of the individual and, what makes sense as the ongoing plan is being discussed and those ongoing supports are being determined. Not seeing any questions, so I'm going to move into chore services. So chore services, and I'll give you a sneak peek. We're also bringing in something called homemaking services or proposing something called homemaking services. Chore services is a little bit distinct. still provide an individual's home, but this might include not necessarily day-to-day tasks and activities that you might associate with a homemaker or a service provision from a homemaker, but this might include things like minor home repairs, housekeeping, certain specific chores, especially related to egress, you know, if you've got a loose step, if you've got you know, something along those lines, you know, moving of very heavy things, tacking down of rugs that might be lifted up, you know, those types of chores that might not be like a daily or weekly type thing that's just you know, assumed to be needed in the course of updating the interior of that home. So we've introduced that in here as a service definition, proposing an annual limit of $5,000, but similar to our current waiver now, giving the flexibility if based on health, safety, you know, health and welfare for the individual and that demonstrated need, the ability to lift that cap on a case-by-case basis. So those are the residential services. Before I jump out of those, I know it's a lot of information, a lot to take in. I think from this group, the same as we asked of the waiver work group, if you think, and you know, folks don't have to come up with that now, but if you go back and you're like, oh, gee, I know of this program model and I'm not really sure which of these services it might fit into. Please reach out, talk to me so that we can see, okay, would it fit into one that we've developed or, you know, was something unintentionally omitted? But otherwise, I think the group tried really hard to keep their eye on that and to make sure that we were staying consistent in the services and the program models that are out there right now, but also bringing more options into New Hampshire. Oh, we got some questions. Stephanie.
Yeah, I apologize if you covered this. I had somebody come in my office in the middle of kind of this section, but this was on slide 2, where you talk about, if you want to go back to that when we talk about in-home personal care.
Yeah.
And it says here it can only be delivered in an individual's family home. So I'm thinking that's like when you live with your parents. Is that not something that you could get in your own home?
So if you're in your own home, that would be supported living.
Okay.
So your own home or one that could be leased or owned by your trust. We've made that allowance, or also based on feedback from some of the families on the work group, we know that it could be that we'll say a sibling might have technically hold the lease for an apartment, for my apartment, but it's my apartment. You know, I'm the one that lives there, takes care of the day-to-day upkeep. We've created some language in there that would allow us to review that on a case-by-case basis. But I think it would support both of those circumstances, Stephanie. It would just, or those settings, I should say, it'd just be the two different services.
Okay, great.
For this one, what we were trying to look at is because right now in a family, service provision in a family's home, really, you know, being certified through 525 is essentially, you know, the option that's available. And we've just had some folks reach out. Some folks very much want to, you know, love the flexibility that self-direction offers. Some families and individuals have reached out though and said, hey, you know, right now that's just not what I'm looking to do, but you know, I really still want to be able to receive this care in my family's home. So
Right, that makes sense. Okay, thank you.
you're welcome. Denise.
Trying to unmute, it's tough. So first I'd like to say this is really, really good. And I'd like to commend everybody who worked on this because this must have taken a lot of sweat and pain. But second, how does all of this map out from a cost perspective into a budget to actually be feasible?
So do you mean like our individualized budget structure right now, or overarching considering cost neutrality in our waivers?
Yep, that second.
So overarching considering cost neutrality in our waivers. I love that you asked this question. Lori Vachon's probably laughing somewhere off camera at me. But one of the things that we don't often talk about within our waivers is that one of the tasks that CMS gives to each of the states when they say, hey, we'll allow you under 1915C and that authority to create some services. But you need to make sure to show us that in the provision of all of those services, that the total cost to provide the services to you know, in general, doesn't exceed the cost of institutionalization. So when we're talking about, and when folks ask me, hey, Jess, how come we just can't add an unlimited number of services to the waiver? Well, that's why, because we have that cost neutrality component. Right now, we've proposed these services. I think what we would see initially, though, is with the first handful of them, this really, and even onto the second page, I think these are programs that currently exist. So it might be called something different or slightly different, but these are similar to what folks are already receiving. So what we have to look at then are, okay, what are we adding? And that's where we start getting into the conversation around caps being recommended. If we're capping at $5,000, if we're capping at 40 hours per week, that allows us to be able to estimate what some of those cost impacts are to the waiver. So I think our waiver work group too is aware, where we've said, hey, this is the vision, this is the dream. We're going to present it with the provider qualification so that our colleagues in the rate work group can then, jump into figuring out, okay, given all of that, what is this brick building method? And rate work group representatives, stop me if I'm misrepresenting this, but how does this all impact the rate? And then it will go back to all of us here at BDS to figure out, okay, what is the overall impact to cost? And are we maintaining what we need to maintain in order to continue to get that federal support from CMS? So it could be the case that we may have some, after those analyses are done, some recommendations to take a look at some of the services or some of the caps and what we've offered, but this is kind of the evolution of building out the waiver.
Okay, thanks.
You're welcome. And thank you for asking that question. And I don't want to speak for the work group, but thank you for acknowledging their work. They've been an amazing group and really just asking the tough questions, giving the data, coming back, in some cases we were bi-weekly, but it's been going on for, several months, almost a year. And I think everybody was just really committed to making sure to look at all those services that we could bring into New Hampshire, how to make our service array the best in light of what people are currently saying would best support them, and make sure that we were bringing in options that offered more support for folks trying to live as independently as they choose. So I don't want to speak for them, but I think they're super proud of these. And I know that I'm excited for New Hampshire with these.
Just as one comment from Tyler, he says something that just came up in my head, but is there a way we could make the training that companies have, example is ISA in other terms, available to the public? That way people don't get confused with the terminology.
So Tyler, I think the answer to that is yes. We're looking at a whole bunch of training and information to be shared to service coordinators and intake managers and folks who are interacting with the different services. And then for these services, I think one of the deliverables that our waiver work group has been really passionate about is making sure that something similar to what you all are looking at right now, but to add on the provider qualifications and some basic info, is available as a tool both for individuals and families, but also service coordinators as well. More of an at-a-glance view on the services. So what we're not asking them to do is jump into 300 pages of waiver text and try to figure out what service options are available. Broader than that, though, around service agreements, person-centered service planning, person-centered planning, all of these different things that make our system work as best as it can, but also that folks need to be armed with the information, the knowledge, so that they can also have that finger on the pulse to make sure that they are receiving quality services the way they expect to, interact with the system and the outcomes that they are hoping for. Delivering that information is critical, and making sure that people have that readily available. So we're looking at different trainings. Our quality council right now is doing a subcommittee as well to look at person-centered planning in general, and what some of those recommendations might be broadly, and as they might interact in New Hampshire. And then Lindsay, I'm not sure if you want to talk quickly about some of the service coordination training that's coming up, but some of the topic areas that we'll be going over with them. Sorry to put you on the spot, Lindsay.
It's okay. Yep. So we are meeting, as you had said previously, twice a month now with service coordinators to hopefully be ready for the 7-1 transition, but on things like person-centered planning, budgets, service authorizations, Medicaid, kind of an overview, Medicaid 101, we're looking at too. So a whole bunch of different topics.
Awesome. Thank you, Lindsay. So lots of training coming in different ways and to different folks. But I think to your point, Tyler, yes, looking at how do we get that knowledge out to service coordinators, individuals, and keep everybody, you know, best informed on what's going on. What are the new services? What's, you know, like you said, the service agreement, and how is that different from other terms that might be used out there? All right, you guys thought you were done, but you're not, because we're only done with residential services. So now we're going to jump into the day services. Okay, so community participation services are still being recommended. There really aren't changes here being introduced. We are adding in some language about the ability to provide them individually or in groups, but our work group felt really strongly that there be strong language to show that how an individual chooses to participate, either individual or group setting, needs to be determined and that decision led by the individual. And also, actually, there really aren't many changes, although I'm looking at my friend Lindsay to remember if we added language in around the desire for someone who may be seeking to slow down their day-to-day and their hours in general based on either you know, if they maybe I don't want to use the term if they want to retire, because I think what our group has been really supportive and advocating for is, hey, this isn't just for individuals who are aging. It could be for someone who's, you know, seeking a similar lifestyle to someone who might be slowing down, and, you know, typical for other folks in the community who are reaching that point and have made that decision. Did we include that in CPS too, Lindsay?
Yes, I believe so. So
okay, I just want to make sure.
Lower pace. Yep.
Okay. So that was included, that language in there, as well as some language around, you know, what is the community? How do we define community in New Hampshire? And I think what more to the point, how does an individual define community for themselves? Again, individual led, those decisions, I think, how does the individual define community is the key there, because this is a choice that they make and not a choice that is made for them, and making sure that our waiver language supports that. Well, we've got a couple questions popping up, so I'm going to go to the chat box and then I'll go to the Q&A. Oh, thank you, Krista. We had a lot of discussion about group size and remote groups. And I think that what the group wanted to keep in mind when it comes to group size, what does that mean? Should the waiver offer a limit or a max or a minimum? And what we heard were, you know, people wanting to make sure to protect the integrity of not getting into a scenario where the only option for someone might be that, you know, that system driven, here's what the option is, and it's a group, but that the availability does exist when an individual chooses that. If there was, say, a remote life skills class of some sort in it, you know, it was offered to, you know, several individuals, that also that there be flexibility in the service definition to offer both of those scenarios, again, at the decision of and based on the support needs of the individual, to keep those in mind in the selection of any of those particular settings or environments. And hold on, Krista, I'm making sure I captured both group size and so that was both them, the group size, the remote groups. And Krista, I'm not, if you think of anything else too that was part of that conversation, just for this group to, you know, kind of have that 360 view of the different topics that we discussed to make sure we were accounting for, just come right off mute if you want.
Sure. I think the only other thing that I would add is, you know, we wanted to ensure the safety of people who might have more complex needs or be more fragile. And we had a lot of discussion around that and the need to ensure consideration for that, while also allowing flexibility, like you said, for people who had different kinds of needs, who might want to be in larger groups or activities that just naturally happened in larger groups and really not restrict them in their ability to have greater freedom and to grow that way.
Thank you. Yes, so making sure that that language, introduced all of those topics and all of those areas, while ensuring that safety and making sure there was language there about meeting the individual's assessed support needs, but also giving them the flexibility to choose and, striking that balance within the service definition to make sure that what was there best supported folks. So yeah, there's some really good conversations on that topic too. Okay, we've got a couple chats. Okay. So Kathy's saying, I'm seeing over and over again that services cannot be provided by a guardian, but many cannot find and hire staff. So although not their choice, some guardians must leave their jobs to fill the void. Why can't they be paid in a crisis situation until staff is found? How are people supposed to live? Why the restriction? Okay, so in terms of so I think there's a few different scenarios there. And what I'm trying to figure out, Kathy, do you mean a family member or a parent in general, or truly someone who just holds guardianship?
Any of the above.
Okay, so I think we left the flexibility for a family member to provide the services where appropriate. I think that in circumstances where there's a provider operated setting, having that exemption or that carve out is fairly well in line with how that service is likely being provided now. Keeping the flexibility in for some of the residential services where that could likely be a scenario. But in the carve outs for specifically being provided by a guardian, I think we can take that back and see are you?
Well, many times, Jess, you're the parent and the guardian. When your kid turns 19 and you need guardianship if they are not someone who can live independently. So you're both. And if they live in your family home and you can't find staff, I know many families many parents who have left their jobs. They're also guardians. They're doing it all, but they're not making any money anymore. And why should they not be able to pull the part of the budget that's allocated to staffing if they've had to leave their own jobs? How are these people supposed to live? You really, that the system and our inability and our poor decision making over the decades to keep up with funding these positions and convincing that younger people that the work of a DSP is an honorable and fulfilling profession, it's coming home to roost now. And you've got a lot of parent guardians in particular who, through no choice of their own, are facing, how am I supposed to pay my mortgage? How am I supposed to buy food? I can't go to work anymore. I had a good job. I have no health insurance anymore if they're, not seniors. So just taking away in the situation we're in, and we have to be realistic, we are in a crisis situation for finding people to hire, that taking away that opportunity for that person who says, I got to quit my job and be home and do this because I can't leave my loved one alone. But now, and you can't be paid for it. I mean, that's enslavement to me. And I don't know.
Kathy, this is Krista Gilbert. I don't know how to address the parent and guardian when someone is in both roles. I will say I did bring up when it said, the guardian issue, because I am on the waiver work group, and I know at least for some of them, as I recall, there was like a CMS rule that someone could not be a guardian to serve some of those functions, which is not something that I understand, but that be like why that was, but that was my understanding for some of them.
Thank you, Krista.
Jessica, I don't know if that's accurate or not, but that was my understanding for some of them, why that a guardian could not be.
If you're also the parent and the guardian, can you just take off your guardian hat and just say, I'm just being the parent while I'm working with my adult family member, and then they can get paid?
So Kathy, I think what I'm hearing you say is you want, like, one of the advisory committee recommendations right now is for us to take a look at how we've set up some of those limits to see where our flexibility does and doesn't exist. And take another pass at the limits with that lens.
Well, I certainly can't speak for the entire committee, but to me, it's a valid question because I am aware of so many people who have been put in the position to leave viable jobs in the workforce and all the benefits that that entails. You know, luckily, the ones I know happen to be married and have another wage earner in the home, but that's not always the instance. And it just seems when you set up a system that can't deliver what it's supposed to, and this is not accusatory, this is just the circumstances we're in with workforce. The system, you know, is mandated to provide supports and services to this population for those who are deemed eligible, and it can't right now adequately, if we're honest. How does the system therefore get away with enslaving a population, saying, well, I guess you're stuck with it, you have to do it, and we're going to take, not only you have to give up your ability to earn a living, but we're not going to help you, you know, keep your home or buy food by paying you. I just don't understand the linear thinking of that. So I would love it if it was revisited, but again, I would need, you know, you to get consensus from the entire committee. I would not propose to dictate.
Yeah, no, and I think, Krista, thank you for bringing that up too, because there have been some really good conversations around who can, who can't, you know, what are some of the considerations, but I think it makes sense. We tried to keep that in mind as we went through what the requirements were. And I mean, we're working within the guardrails of what currently exists in order for us to be reimbursed, and making sure that what we're proposing falls within those guidelines. But I don't think it's an unreasonable ask for Lindsay and myself to go back and do a quick scan at, you know, what some of those authorities are and figure out if there's some, you know, additional, or if we're still working within the guardrails to propose some other options. Oh, and I see, so Will, you've had your hand up for a little bit, so I'll go to Will, and then there's a question in the Q&A box too.
Sure, thank you. So, you know, I'm wondering what constitutes a recreational activity here. And the reason I get at that is what may be viewed as a recreational activity by some people may be the only way to get somebody out into the community. It may be the only thing they can do to leave the home. So are there exceptions, you know, to say maybe take somebody to the bowling alley because that's the only place they'll go outside the home? I mean, what is in place for CPS to support that?
Yeah, so for CPS and supporting individuals in the pursuit of recreational activities, what the waiver services can pay for are supports while someone is there. If they require, you know, partial physical assistance, full physical assistance, things like that. We could look at the waiver for providing transportation to get there. The only thing that the waiver really can't cover is maybe say the bowling lane alley rental itself and those fees, but the supports during in order to get to that is within the scope of the waiver.
But what if bowling is the only way to get somebody out of the home, right? So it's not really recreational at that point. It's more of a community participation in that point, getting somebody out of their house.
Yeah, I mean, I hear what you're articulating. I think it would still be looked at as a recreational activity to get them out of the house. What we want to make sure we're supporting within the waiver, what's within the scope of what the waiver can cover are the supports during and the supports to access, just not the fee to access itself if it's considered recreational.
All right, and there's no exception process around that?
Unfortunately, there isn't an exception process around that.
Okay.
And just if it's helpful, I mean, well, this is a topic that is growing nationally of a request for CMS to look at this more holistically. It's not a New Hampshire issue. It's unfortunately a pretty direct line that CMS calls out in the technical guidance and really has been driving states as a non-allowable cost. So, but it is something that other national groups are looking at and having conversations because it is a growing topic, especially, you know, learning from the pandemic and coming out of the pandemic of other ways for people to be engaged in the community.
Okay, thank you.
You're welcome.
Jess, this is Lori. Before I see Stephanie has her hand up, but there is a question in the Q&A that is just right along the lines of this from Karen. And I think you responded to it. I just wanted to make sure that we just, while we're on this topic, is, you know, with CPS, can you pay for support during a recreational activity, even if the recreational activity is not paid for by the waiver? And I think you said yes.
Yes.
So I just wanted to make sure, Karen, we loop back to you. Sorry, Jess.
No, thank you,
Yeah.
Lori. And then there's another question. Can the cost for the staff to participate be covered? So the cost for the staff's hours for providing support can be covered. The cost for the staff to, I think taking Will's example, if it were at the bowling alley, the cost for the staff to rent shoes and participate in the bowling activity would not be covered. Stephanie.
Jess, you faded out, but Stephanie.
Oh, Stephanie, sorry.
Yeah.
Okay, I just wanted to follow up on this too. So I understand the position of BDS on things like bowling. I'm not saying that I agree with it, but I understand what you're saying. But I'm confused about services like therapeutic horseback riding, where it's not a horseback riding, it's therapeutic horseback riding. It's meant to help someone gain, you know, muscle skills and control, things like that. I always thought that there was there's like a difference between therapeutic horseback riding and whether CMS will pay for one or the other. But it seems like the recent position of BDS has been that no, none of that's covered.
So I think I would need more context to that. And I get nervous answering things, you know, with a broad stroke, because I think there are a lot of nuances to that question around assessed needs. What are the assessed needs? What can we pay for? What can't we pay for? What is different in each of those environments in terms of supporting the individual? So, and I think, I mean, Stephanie, would it be okay for us to connect separately to kind of talk that one out and figure out, you know, what we think is allowed and isn't allowed, and those types of things? Because what I want to make sure too with folks on the line too, so that construct and that requirement and what we're following based on the guidance that we've received from our federal partners is not part of systems work. So I don't want folks to think that these concepts are being newly introduced into these services. And that it's somehow part of the new services that the waiver work group has been building. These are some pretty consistent, what we'll say, outcomes and norms from CMS based on their guidance of what they feel is within the scope of the waivers and what they'll provide. But
we can follow up with it separately. I'm
Yeah,
happy to do that. I mean, just one other point about recreation. I will say that while this is a big lift for a family, and I recognize that, there may be arguments to be made that if someone needs a DSP to participate in a recreational activity, that as an accommodation under the ADA, they can't charge you for that. Like if you can't go to a movie without a DSP, then while you might not be able to use waiver services to pay for that, I think there are maybe cases where you could actually say, well, this is an accommodation that I need as a person with a disability to participate in this movie theater. You're not allowed to charge me.
Oh, I would love to connect with you on
So,
you know, to message that out
it's
to
different
people.
rules, it's different laws. You're approaching the problem differently, but I think that there are sometimes places where you can make an argument that this is a reasonable accommodation that Canopy Lake or the movie theater or bowling alley should be provided.
Yeah, I would love to connect with you just to see like, how do we get that information out to folks to best support them and working through some of these activities and some of these questions that are coming up. And everyone on the line, what I want to say too, is I hear that these are important questions. So please, I don't want you to think that we're glossing over them or anything, just, you know, maybe picking them up in a separate conversation, hearing some of these questions that are coming through. Oh, and we have a question in the chat. Okay, but Kathy's saying, but habilitation and amelioration are service guarantees in 171A. So the state should pay for staffing and access to those activities if CBMS won't. What is the plan? Yeah, Kathy, and I think that, you know, in terms of the general funds that we allocate out to our family support councils and for the provision of those services, I think that those structures are in place, and not to rabbit hole us in a conversation, because I do want to jump in. There's a lot of support services for the last half hour, but yes, I think that it is still important that we are making options and, you know, funding available in our service system for some of those things, even if they are outside of what the waiver can cover.
So I think we can't be discouraging families from putting them in their service plans then. They're just gonna have to be funded in a different way, but that's gonna be for the Bureau to figure out. It's still, if it's something like Will said, if, you know, getting out in the community requires a certain strategy, you want that in your service plan. Because the service plan is your roadmap for helping this individual access their life that they've chosen. And the Bureau will have to figure out the funding for it as a process. But I don't think it should be omitted from the service plan at all.
Or maybe Stephanie and Isadora, something we can talk about in the person-centered planning group too, in terms of, okay, what does this mean for someone's overarching person-centered plan, their overarching goals, ambitions, desires, you know, what the service plan, if we're thinking strictly the individual service agreement, that is the it's so much more. But if we were to really, you know, boil it down to what it is from the CMS requirement, that is how we lay out the services that the waiver will cover. But to your point, Kathy, then what and where and how do we introduce those overarching goals? And I think that's something that within the Quality Council we're trying to pick up and figure out how to best support people through those conversations and how that interacts with service planning. It still says we have two. Oh, I'm sorry. I've just marked. So hopefully the folks that asked the questions in the Q&A, I marked them as done because they were still showing up. But if you still have follow-up questions, feel free to add those in. Stephanie, you have your hand up still, and I just want to see it. Okay. Anne's got a question.
Yeah. It just ties into all of this because this is how my morning started here, is that the in-home support dilemma that we're in right now rings true with what you're giving us here on definitions, that I have families calling. I have a council that's pretty upset because you actually just said to it that the council will have to pay for these activities. Well, the council doesn't have that kind of money to pay for these activities for every family who has those type of services. Also, they want to know, and I've tried to explain it to them, but don't be surprised if you get a number of phone calls, why CMS won't pay for recreational activities, much based on what Kathy Spinney was just saying, what's based what Stephanie was saying. I understand they're telling you this, but families don't agree at all.
Yeah.
And we need, what would be really helpful for us is getting in writing what you will pay for, because I've been given 3 things that you will pay for, and the rest of it's off the table.
So, and I think one of your team members had reached out to me in another meeting, Ann, and you know, what we've said is, hey, raise a hand, talk to us. We're happy to join and help support some of those conversations, because sometimes when we have, you know, evolving guidance, whether it's from the state or from, you know, our federal partners or whomever, while we're trying to implement it, you know, we want to make sure that we're best supporting everyone in our system to have those conversations so that, you know, people understand what the next step is. So I think that as those conversations happen and or are attempting to happen, to please reach out to us and let us know how we can support and join those conversations, and just make sure that everybody feels like they have the info to share that and to relay what's happened or how some of this information has been received and how it's being operationalized.
So, all right. So it just goes to just something else that you just mentioned, was the service agreement and person-centered planning. When we did the settings rule, person-centered planning, there was a way in the settings rule, if a person's door really should not have a lock on it for mental health reasons, for a number of reasons, that should be built in, my understanding, into their person-centered plan, and they should not be violating the settings rule. or the lock on the door or the whatever's there. Whatever's in that document, as long as it's written in a way that it's what that person needs, then nobody should be making any complaints. But right now I have all these in-home support people, and I think we would go down this road with these definitions, who their ISA said they would have all those things, and it changed. So I'm just throwing it out there. I hear what you're saying.
So, and this is Lori. I meet weekly with your staff, and I've been meeting with them on a regular basis on this. I think that the service agreements didn't clearly outline that in the past, and as we've added different services in, and people are identifying we want specific money for this. We are, the technical guide of CMS says we don't, we can't use waiver funds for recreational or diversional activities. So I think it's coming through as people are beginning to specifically ask for it, that we're reviewing it. But settings and this are like two totally different things, but it can be confusing. Stephanie, I think you brought up good points earlier about adaptive or therapeutic programs. We are looking at those, and if they're credentialed, and this is where it gets hard to say, we will do this or we won't do this. It's really a person-centered approach and looking at what does this mean for the individual? Is it related to a specific disability and, needed, or is it social recreational? That's where we have to look at it sometimes at an individual level. But Anne, I would be happy to continue to meet with your team as we go through
It isn't the
this.
team, they get it. It's these families, and they are very upset.
Okay.
The team gets it.
Okay.
They understand. So the families have been told, they've been told the CMS language, they actually have the language.
Excellent.
And they are not happy.
Yeah. Okay. And I think that's what Sarah tried to. Fair enough, Anne. Yeah. Essentially looking to be, to provide the information we can, to provide the written information too, and have a conversation around that where necessary. In collaboration with and support of our agency partners who, to her point, hey, we're all trying to come up to speed with this too. And if we have the best understanding possible of what's going on, it'll better support us to provide that information to families who, understandably will continue to advocate for and identify the support needs, where, in exploring funding avenues, I think is where the conversation shifts a bit.
Right.
Yeah, and one of the ideas that could come out of this, and I don't want to take us off track too much, is maybe we work together with you, Stephanie, with us on developing what resources do exist that you could tap into for those supports, like Harry Allen Gregg, Family Support Council sometimes, and looking at the ADA. So maybe we could work together on, what are other resources that could be pursued and shared for individuals and families to get those needs met, or to support some of their recreational goals.
Okay. I'm open.
Right?
I get totally.
Yeah.
If you open Pandora's box with CMS, you watch out what you wish for.
Yeah.
So I get that, but we need to have a continued constructive conversation.
Yeah. No, good point, Anne, and that might be something that we could work on together.
Yeah.
Tyler. Did you have a question, Tyler?
Hi, apologies for the noise. I'm currently at the laundromat right now. So something that I wanted to bring up with Will is I can't remember what he said specifically, but I do remember him saying something on the lines of being able to specifically understand what services are being provided when it comes to communal and other services that are in the community. So I think that would be funded by Social Security. At least that's been my experience. And what they can do is they would be able, the case managers would be able to give specific individuals who have funding or have a specific budget in mind for how much they can spend. They can give the clients what the specific money for services like going to the movies or doing weekly events. As for what Spinny said, I do agree that it can get really frustrating over time, not being able to fund these specific events and such, and not being able to give people who truly need this money in order for families and providers to really find the specific funding can be really tough for people who are down in the provider side versus the higher ups. So when it comes to paying and when it comes to even like getting these emergency services, it's really, really important, because if you have a mental health crisis and you don't have individuals who are going through these specific services, you can't just send them to the hospital. That wouldn't work. So it's really important to either train the families or be able to give the families who did give up their jobs to be able to get paid for these things. Thank you.
Thank you, Tyler. Yeah, so I think that that's in support of Kathy's, recommendation that we take another pass at who can and can't pay and see what our flexibility is. And thank you for the info on Social Security. Maybe when we, Lori, Stephanie, and I connect, we can take a look at what some of that is too, or what some of those options might be too in preparing resources.
Jessica, Mary Ann has a question on the question and answers.
Okay. Oh, Marianne is recommending hi Marianne, I didn't know you were here today, an open family training of some sorts with BDS to explain to families versus area agencies having multiple long back and forth conversations with each family. So I think, another thumbs up to the idea of additional communication for sure. And, collaboration, answering these questions together and, providing that insight on what some of the guidance has been and, how we move forward. Okay, I'm going to go through the additional services here before we flip into support services. But what the waiver work group is looking at is transitional employment services to go along with supported employment services. So supported employment services, not a lot of changes recommended there, although the introduction for a few additional functions within SEP to broaden what can be covered. The transitional employment service category, and I'm going to look at my friend Lindsay here, but one of the things, so again, what was the problem the waiver work group was trying to identify? And one thing that people said is, hey, we think that might be the case that because of the credentialing requirements and supported employment for folks who maybe aren't necessarily looking to access those on the job supports, they might be receiving some of these services or some of these supports through CPS right now, because it does feel more appropriate at that point in time. But wouldn't it be great if there was a middle step where we had somebody who was trained to provide employment services, but maybe before they get to that next benchmark of participating in employment, receiving those services and working towards their work goals, there was a service provider that could offer transitional employment services. Lindsay, did I explain that well?
Yep, I think you did. So the discovery and development phase. So working on the resume piece, maybe practicing interviewing skills, having that as separate from the actual assistance at a job.
Thank you, Lindsay. So again, one thing, important to our work group through these discussions is taking a look at across various levels, what documentation requirements, certification requirements, credentialing requirements, making sure we're keeping what makes sense and what is appropriate to ensure that individuals are meeting their goals, focused on supports that will help them meet their goals. But in instances where, it might be possible to look at another service provider, another provider who might have slightly different credentials, but still moving in that direction to be specific towards that goal, to bring that in, to create more flexibility and what we hope is more access of individuals in working towards employment goals. And we have a question in the chat, sorry. Oh, Tyler's just letting us know he had to turn off his camera quick. Okay, and then SEP still being proposed as a service in the waiver, really important service that we want to keep and preserve in our waiver. I think there are a few expanded options here. For example, if somebody is at work and they're, is a natural support in someone who's naturally supporting them at work, but it's above and beyond what the role of their typical position might be. So not when someone's onboarded, you might be, have a mentor to, help you with the onboarding process for the first few weeks. But let's say that mentor was really beneficial towards supporting the individual and in meeting their work responsibilities. But it exceeded what was typically expected of that individual. We might be able to, or we could look at SEP in this proposed definition to provide some additional reimbursement for that individual who was working technically beyond the scope of their job in that situation and supporting the individual in their work responsibilities. Oh, Stephanie?
One of the situations around supported employment that I'm aware of are situations where someone needs supports to be successful in their job, but they don't need to be provided actually on their work location or during their work hours. Like someone who might need to have someone they can check in with about social situations that are happening at their job, but they don't particularly want or need to have this meeting at their job site during their work hours, because it's not really, that would be more appropriate to be outside of that, like in the evening. So just wondered if you thought about that flexibility, that it's a support meant to benefit their employment, but it might not actually happen during their working hours or on their job site.
I believe the answer to that is yes, but Lindsay, and I hope that I've introduced Lindsay before, but she is amazing. She comes to us with a wealth of experience, especially in these areas. And she has been really critical in guiding and making sure some of these service definitions are preserving what's good, but bringing in what we all want to bring in. So Lindsay, can you speak to that at all?
Yep, I just was double checking, but yes. So I think the main idea is to have these contacts happen at the job site, but we did build in language that if the individual chooses not to do that, that's will be documented in their service agreement. And so it doesn't have to happen at the job site.
Great. Yeah, I think I'm aware of situations where it seemed like it would be more appropriate to be outside of the job site, but still helping with the job. Good. Thank you.
You're welcome. So again, some more of that info that we heard back from the group and the flexibility that we were seeking, and how do we build it in a way that also keeps an eye on individual choice and, making sure that we're upholding the tenets of the service itself. But based on individual choice, are there other options and where that service can be provided? So we're happy when we're able to introduce those flexibilities that folks are really reaching out and asking for. And the last service here is actually the newest addition to this service array from our work group's recommendations. And this is adult medical day services. So anyone who's familiar with our Choices for Independence waiver may already be aware that this is a service offered under their waiver too. And this would offer this service to be provided in a non-institutional community-based setting. You may be aware that our state plan offers a similar service as well, but what our waiver is seeking to make sure are provided in the pursuit of that service are the additional supports that someone may require in order to be successful in participating in that service. So it really makes sure that there is the availability and written within the service definition for supports to be provided based on someone's assessed needs. Okay.
Just Tyler has a question.
Ooh. Oh, hey, Tyler. Hey, Tyler, I know you had to turn your camera off. Do you have a question for the group?
Oh, I just wanted to explain something that recently happened. So I actually worked at so what happened originally at my work when I left is I slipped on ice and fell with like two 10-pound things of window washer fluid. And when I was trying to go through workers' comp, I had a really hard time with it. And The people I was working with didn't really go in and talk to my boss. So I think that really damaged the relationship between me and my new boss that was recently put in there. And the reason why I left my job was not only to help you guys, but it was also because I couldn't do the physical work anymore. And it was very frustrating to go through that process without any real help. So I think when it comes to getting the medical day services, I think it's really important to have that training in there for people who are CRS so that they can help people who have been through that workers' comp situation. And if they did damage themselves on the job and they had to leave, it's really important to give people the ability to say, hey, I'm leaving because I was hurt on the job, and they need to be able to get covered for those costs.
When the road comes.
Yeah, so it sounds like you might be advocating for a couple of things here. So one I'm hearing is within supported employment or transitional employment services, some of the other things that might come up in the work environment and helping someone navigate through those. But also as someone might transition between some of these day services to make sure that some of those supports that might be identified as a result of another life event are included in how someone participates in that service. Did I get that right?
Yeah, and so would individuals who, because from my experience, no one in like work opportunities knew how workers comp really worked. And we were going through a difficult time with individuals leaving, and it's been really tough to try to like communicate with them, hey, I need help with this. So I guess my question is, would work comp and other things regarding the CRI services be covered in what their training is?
Okay, that's a really good takeaway for us to look at. I don't want to answer off the cuff unless somebody on this line knows that off the top of their head, but we can definitely research that. And Tyler, if it's not included, we will make sure, because that's the next step, is for us to go through provider qualifications. So we can take that back with the waiver work group and see how to introduce training on that area to make sure we're best supporting all of these employment scenarios that someone may ask for support with.
Yeah, because I had to do all the work comp all by myself, and it was really difficult to really like reach out to individuals in like the HR. It was I'm not gonna lie, it was absolute hell. So if people who I don't want to say less competent, but more of they don't understand how workers comp work or HR works, or even how the company works, it's really important to connect with these specific, I want to say specific specialists. So if there's like an HR specialist for, let's say, work opportunities, it's really important for them to connect with the clients, be like, hey, can you tell me what happened? Okay, I'll contact the right people so that you can get this covered. And then honestly transport to these specific workers' comp appointments is really important too. So I just wanted to put that out there. Thank you.
Yeah, thank you. And thank you for making that recommendation, but also for sharing that experience with us to really kind of understand, the scope of that recommendation and how it's impacting transferring between services, provider qualifications, provider training. I think that's a great information that we can take back to the waiver work group too, and figure out what does that mean for provider qualifications. And in that scenario, what, who, or maybe it's multiple people would lead that, but to make sure that provider is trained to understand the nuances, what those areas are. You mentioned HR, there could be a VR component. Who are all of those? What are all those support systems that could help someone in this circumstance? Okay, so I might be able to go through the first slide of support services to talk to folks a little bit about these first few. Again, I know this has taken up a bulk of the meeting, and those of you who know me well know I could talk about these waiver services all day. So, but I also think it's important that we're able to talk and work through some of these, because some of the feedback and recommendations that are coming out are really helpful for us in the waiver work group as we, work through some of the services that are new And, they're in concept now, and what we're trying really hard to do is put them on paper and make them a real service that folks can access. So it's been a great conversation. The first one that I want to introduce to you all is support brokerage. And this would be provision of information and support for individuals who are self-directing their services. So a support broker is someone who's knowledgeable of the service system itself and participant directed and managed services, and can help the individual work through various areas specific to self-direction. It is different than a service coordinator. Somebody could have services from a support broker and a service coordinator. There shouldn't be an overlap there, but it is meant to provide additional assistance in self-direction. And I'm going to look at my friend Abby Conger to provide a better explanation on that than I just did. Abby.
I think you did a pretty good job, Jess.
Well, thanks, Abby.
The only thing I would add, so the difference between what a support broker would be able to do for an individual or family self-directing, one, we hope it opens up PDMS to more individuals and families that may not feel that they have the confidence, the ability to manage their own program. We're hoping by introducing the service of support broker, it gives the family somebody to lean on in terms of those managing their family managed employee, reviewing the progress notes every month. I mean, there's quite a few different things that can be done as a support broker that isn't truly within a service coordinator role. So we're hoping it helps bring more families into the program. We're also hoping what it would do is for maybe circumstances within a family circumstances change, and they have been successfully managing their PDMS program for a number of years, but then maybe need a little bit of assistance. This is a support service that can come in and help that family or help that individual kind of get back on track with running their own self-directed services program and then fade back out again. So this is a service across many other states that we looked at. So I'm really excited to see this one. And like I said, I really hope that it helps grow self-directed services.
Thank you, Abby. Will.
Yeah, thanks. So I want to understand better what this means. So my wife and I, we are on PDMS for our son. Yep. Does this support broker do the same thing my wife and I do monthly? Is that what it means? But we end up having somebody that could do it for a fee.
What that support broker would help support you and your wife to do it. So it is not to fully replace the responsibility that families take when they look to do the PDMS model, but it's to support them in those areas where it is typically outside of a service coordinator's role.
Okay, so what you're saying is you identified a gap between parents and the service coordinator, and you're trying to fill that gap with the service with a support broker.
Yes.
Okay, thanks.
Yeah, and in a way that we don't want to set up a system or a scenario where someone's authority in employer or budget might be unintentionally, I'll say is likely what would happen, but stepped on, so to speak. We want to make sure folks still feel confident that they have that employer and budget authority. But what people have been telling us is, hey, there needs to be some additional assistance in figuring some of this stuff out. And, how do we help bridge that gap to encourage and support self-direction and not make it seem like something that, that if you're not sure what to do or how to do it, that it isn't achievable for you. We want to make sure that it is accessible for everybody who feels as though they want and desire to self-direct their services or services on behalf of their family member or loved one. Okay, so remote supports and monitoring. This will probably be the last one I'll do today because we're almost at time. This is the best way I can describe it in a 30-second snapshot. Is very similar to CSS, but using technology. Somebody can have CSS and remote services at the same time, remote support services. The CSS at that point, though, if you were accessing both, we would want that to be done in person. Someone who doesn't have remote supports and monitoring, though, as a distinct service might still choose to access their CSS services using remote technology. That will still stay. We want to leave that flexibility. But what this allows is that more support using some non-invasive, various methods of technology, various options to allow for that support to be provided. So that could be in the way of, you know, getting in touch with someone. Maybe you're going through an activity to budget out your weekly shopping. And instead of reserving that for when your support provider or your DSP might be coming to do that with you, maybe you're doing that independently, and what you have are a few questions you want to reach out to someone. That's one of many scenarios that we could probably all think of, stuff right off the top of our head where this would fall in. But this would allow us to do this and reimburse that support time through the waiver. And my bell just chimed telling me we're at 12:30. So there are still several services, and I know everybody likely has a 12:30 to get to. Some new ones, some similar ones that we've seen, some consultative services are being brought in. I'll flash them now, but I am always willing and happy to have a longer and deeper conversation about all these services. And I'll talk to the team too about how we're able to finish up this presentation with this group too, and go over the remaining services. But I mean, if there are any, I'm happy to stay on for a few minutes too, if folks have some initial takeaways, some feedback. Are we on the right track? Are we not on the right track? Or even just reactions.
Jess, you have some comments in the chat.
Ooh, comments. Okay, let's see.
The first one starts with Will. Do you want to read it?
No, I'm looking at it right now. So Will's asking, he was asking for the opportune moment to ask about person-centered planning aspects of things, but we may not get there. So the DHHS page describes the SIS-A as a person-centered planning tool. Have DHHS and families aligned on what the acceptable tools will be for person-centered planning? So thank you, Will. And I want to acknowledge that Will did reach out to us and pointed out that our website does articulate the SIS-A as a person-centered planning tool. And I think what we at BDS are in the process of doing is taking a look at that language to make sure that it's saying the same thing as we are trying to express from our service system around person-centered planning, so that we're not inadvertently messaging to people that their SIS will be their person-centered planning tool. One thing, and I mentioned it earlier, but our quality council has a subcommittee right now to have a conversation around person-centered planning. What are the tools that are available? What person-centered processes exist out there? What are the training? What training exists for professionals in our system to participate so that they're on board with person-centered thinking and those processes? So what you're bringing up is very important. And I think that having that in general, that understanding when we're talking to everybody about person-centered planning in general, figuring out those hopes, dreams, goals that I might have, and how that interacts with and impacts my service planning, but also how that interacts with and impacts any other community resources and supports that might be helpful from a funding standpoint, or resources, various resources in helping me to achieve those goals. And I think that that's kind of the message that we're trying to articulate, more specifically than looking at any one tool, or especially the SIS in terms of person-centered planning.
Thanks, Jessica. I just want to quickly add, just please involve families and what that means. Thanks.
You're welcome. And well, Stephanie Isadora, I'll connect with you at our next meeting on that too, but just to see who from the quality council is engaging and representing families in that conversation too. Just more of an aside, I'm thinking in my head in case you forget about it. And Stephanie's saying, thanks for all this information and the work that's happened. Oh, she had to go, so I'm talking to her here and she's not even on, so I'll connect with her out there. She'd appreciate if this recording and meeting was put on the redesign webpage. She's saying that recent advisory committee recordings haven't been posted. I believe we are going through that process right now to see what needs to be updated in that transfer, to make sure that all of those resources are posted. Kathy says support broker. She's done this over the years for other families just to be a helpful resource, and she did it for free. Who knew she should have been paid? Well, I think that's what we're trying to bring into the waiver, Kathy, is to make sure that that is a service that is available that folks can or the provider of that service can be reimbursed for. But it is sad we are introducing a new position service to pull out of someone's budget while taking away so many valuable previously available activities. So going backwards in the wrong direction, very sad. So Kathy, I think the goal moving forward is that anytime someone raises their hands and asks for a service, moving forward, that it doesn't take away from another service. We don't want to introduce support brokerage so that somebody has to make the hard choice. Okay, does that mean I have to reduce my day service hours? Does that mean I have to, reduce the funding I had available for that ramp I was hoping to have installed? The goal here is for this to be provided and not have it impact the services they're currently receiving. So I hear what you're saying, and I think what I want to say to that is that we're keeping that in mind to make sure that what you're worried about the outcome being is not where we're moving.
I think more what I meant, Jess, is that helping someone who is possibly implementing a model that is the state's preferred model, because it does take so much day-to-day weight off of the state and its contractors, that charging them for advising them of how to do it more easily seems a little heinous to me. And at the same time, we can't have therapeutic horseback riding anymore. Nobody can go bowling anymore with their friends, and which is all about community access and living an ordinary life. That's my point. That's where, to me, it's gotten sad. We're charging families for things that the state should be taking responsibility for, and the federal government is taking away the opportunity for people with disabilities to just be ordinary people and have the same experiences that the rest of us have, and punishing them because they need supports to do it, and just saying, well, we're not going to support you to do that anymore is heinous to me. That's my only point. And none of it is personal or ill-intended, but it's the way things are generally going for this population, which is just backwards. So that's all.
Thank you, Kathy. And I think what we're hoping is that support brokerage, I think I've heard, definitely opinions on recreational activities and how that thinking has gone. But in terms of support brokerage, I think the goal here really is to make sure that there are services available or support available for folks who want to self-direct and not, have a gap in getting that information and oversight of the program and helping them through those. It kind of goes back to that question that we're trying to solve, and we've mentioned it in different meetings, in any service participation, self-directed or otherwise, if we were to ask somebody who's been participating for a decade, what do they wish they knew in the beginning that they've learned through the years? And if there was information and a person who could share that information, natural supports are great, but I think you've been a strong advocate for, also making sure folks are reimbursed for their supports that they're providing too, when that's appropriate. So I think the hope is to bring this into the waiver to enhance and bring more access and not to take away from. Oh, and Isadora is still on, so she heard my, thank you, Isadora. I think that, Tyler's got his hands up.
So apologize for the background noise, but something I wanted to bring up is so when it comes to natural supports, it's very important like I said earlier, it's very important to allow these services to be given to both families and for individuals who are in a company. But I think the main issue people have, especially in the family regard, is that they're not getting paid for what they're doing. They're giving these services to people, they're not getting referrals. It's very hard, and this is a thing that's been periodic throughout the meeting. So if we are in a crisis, it is very, very important that we try to look at these services, say, okay, so who's going where? How are we going to get these services in? And I actually thought of EMS, which is emergency management services. And that would kind of be a branch toward different kinds of services. Like, for example, if someone is looking for residential services, then the individual who works in EMS would go to the family's house and then ask, okay, what does this individual need day to day? And then it would fit what the individual is looking for to their specific disabilities.
That's a great recommendation, Tyler. We'll take a look at that too, because I think, you know, a lot of folks, families, advocates have had that conversation with us in these groups and in other groups too about, you know, the work that we're doing and how we can keep in mind natural supports and the impact in natural supports, to Kathy's point, from someone who is feeling like they have to provide them for various reasons versus someone who's choosing to provide them, and what all of those different impacts are on the system and what parts of the system impact those decisions.
Another thing that I've noticed is that a lot of, again, the families are the ones that are being impacted by this. So how are you going to give those funds to the families? Because I understand that the companies are able to get these funds because they're, you know, augmented into a specific system. But the question is, how are the families going to get this, and how are they getting support from the government in order to get these services? Would they be funded by the government, or would they have to get services from other individuals like teacher sales in order to get these specific things funded?
Those are all great questions. I'm not sure that I know the answer to some of those things. I think a lot of it, has to do with who's billing the service. You know, does the provider work for someone? And how are they reimbursed? I don't think there's a broad stroke answer to that, but, you know, maybe more multiple ways that somebody is reimbursed for service provision.
Okay. And
Including
the last
family.
that I will definitely add here is there's two services I have in mind. Vocation rehab is great for this specific thing, but if the individual is not looking to become independent, then and if they have a mental health crisis, then they can always go to something like Lake Region Mental Health, or they can go to a mental health professional in order to discuss these things. But I don't think people know how to look these things up, and with how the internet is nowadays, and it can be very hard to find these things. So would you be able to add like what specific mental health services are in their area, in the areas, in order to help these individuals find what they need to find?
Yeah, I think that's an awesome recommendation in terms of resources available for individuals to access who might be looking up that information on their own, but maybe also as we're moving into some of the service coordination training too, you know, also the same thing, how to access and look up those resources, and best supporting individuals who are looking to maybe their service coordinator to help them identify those things.
Okay, thank you.
Thank you.
There's a comment on chat from Will.
Okay, and I'll read Will's comment, but I want to thank everybody who stayed on the line as well. I see we're about 15 minutes over, so I understand if folks have to hop, and I'm going to go ahead and read through Will's comment. But you know, thank you all, and we'll make sure to get some information out as well about when and how we'll go over the rest of the services. Okay, so Will said he's looking forward to the FAQ that Drew said would be coming out, and he thanks us for doing that. He's also looking very hard for a before after view of things. It's very hard for me to talk with other families when I don't understand that fully. So kind of a where we are now and where we're going in the future is what I'm seeing. Is Will still with us? Yeah. I think, and I'll say from personal experience too, Will, it is challenging because sometimes what folks are familiar with is where we are now, and to describe in a conceptual way something even like new services, never mind, you know, new structures for some of these other mechanisms, it becomes not a challenging conversation, because I think it's always a good conversation, but figuring out how to explain that in a way that you can't quite touch it or see it, but you're talking about it. I know that's been something I've had to work through as well.
And
Yeah,
just, I'll just, I know we're ending, but we'll just, another heads up. This is something that we're also talking about for the spring newsletter and working with the communications committee, which is inclusive of a number of families, to talk about how to kind of show that how are things today and what will they look like, first with that deadline around July 1st. And then I think you're also asking about kind of the bigger of after July 1st, as we're talking about new rates and new services. What does that look like? So definitely have heard the message and are looking for ways to get that information into the hands of families.
Great, thank you.
You're welcome. All right. Well, so thank you, everyone. You guys have been great as usual. So please, if you've got things you think of after the fact, if you're like me, I process through things after. So reach out, talk to us, let us know what you're thinking, and, we'll be back in touch next month and for our next committee meeting. And I hope you guys have a great month until then.
Thank you, Jessica.
Everyone, have a great day.
Take care, everyone. Have a good day.